out of high school, how you ended up at Wilkes, how you ended up in pharmacy.
Yeah, so I will tell you that my adventure even to start pharmacy was really really lucky in that somebody had proposed to me that I should look into pharmacy as a career, and I think as a high school senior, as 17 years old, I didn't really know what I wanted to do. I had some grandiose ideas, play professional baseball or rule the world, some of those, but when it came down to what I needed to do to grow as a person, it was presented to me pharmacy, and I thought, this sounds kind of cool. I mean, it wasn't just the idea that it was mathematically focused or there was a science base to it. As I talked to a lot of people about the degree and the profession, it was a lot of talking to people and a lot of figuring things out. So a lot of problem solving. And I think the more I've gotten into my career, I found that problem solving and doing things, not necessarily in a traditional problem solving way, but some of the non-traditional ways we have to approach things has been really, really fun. And so when I got into pharmacy school, it was, problem solving from day one. And probably that first bit of problem solving was figuring out me and figuring out how I learned and figuring out how I was going to interact with people. I don't think they're things that I necessarily thought about before I hit college and before I hit a professional degree. Just, seeing a diverse group of people in front of me and how the things that I do and the ways I act, influence them and how they influence me. And then as I started to go into pharmacy school, I started to see that these things about interacting with people really played into the decisions that I was being asked to make about medications or when I'm educating people. And so I found, Wilkes, and I found the School of Pharmacy to be really a really big player in my development as a person, as I kind of ventured out of that protected world that I had into a larger world, where the university and the School of Pharmacy kept me safe, but I had the opportunity to explore and to learn how to work with people and work with healthcare and really be a good member of a team, whatever that team would be.
Dan, did you, at the time you were coming in as a pharmacy student, did you envision your career ending up where you are? Did you know, everything about pharmacy at that point? Tell us about, your postgraduate career path and kind of how you ended up where you are now.
Oh, Lord. Well, I can tell you when I entered pharmacy school, I kind of had the vision that I was going to graduate and I was most likely going to work in the traditional community pharmacy dispensing role, interacting with patients. And that's because what I was most familiar with, working with my parents, my grandparents, to pick up medications at a Ray and Derrick, which, eventually became CVS. And so I thought that was going to be my path. And then I hit pharmacy school and had some friends who worked in independent pharmacies. And so I thought, man, I was going to be a store owner. Hit my fourth year of pharmacy school, did a rotation in ambulatory care, and fell in love with the idea of a pharmacist working in a physician's office, and said, this is exactly what I want to do. I want to work in the physician's office. I want to collaborate with the physicians and the nurses there to make sure that patients are on the best medicines that they can. And then as I graduated from pharmacy school, I said, well, in order for me to hone these skills, I want to do some postgraduate training, so some post-PharmD training, and ended up in the South. And while I was there, I was affiliated with a college of pharmacy. And this idea of me being able to work in an ambulatory setting or an office-based setting and to be able to teach students was really appealing to me. And so I furthered my training then as I went on to a second year of training to not only focus on how to work in a physician's office, but also how to be an educator. And it kind of led me then into this career of academics. And so the entirety of my career in pharmacy since I graduated in 2002 has been in academics, and it's been teaching. I was a faculty member with Wilkes University for a good portion of my career, and an extremely formative part of my career. In that it's made me who I am today. So I joined Wilkes when I was a college freshman, and they stuck with me into my 40s. And it's amazing the amount of influence and growth that I've had, even beyond pharmacy school, with the university. And as the university grew and helped me grow into an educator, I earned a master's degree from Wilkes in education while I was teaching it with my PharmD. Just recently completed a doctorate in education with Wilkes, having my PharmD. It opened up a lot more opportunities, and as sad as I was to have to leave when I did, it was because an opportunity came up that I was able to grow the educational arm of a health system. And throughout all of that, I've found new things in pharmacy that I could do, and it's been so rewarding and so fun to see that where I started, I'm going to work the bench at a CVS, at a Walgreens, at a Rite Aid, and have a positive impact on my community. It's now evolved into a positive impact on the thousands of students, and now it's a positive impact on pharmacists, patients, physicians, nurses within a health system. It's been a true evolution.
Yeah, it's awesome. As you know, we had the opportunity to work together for a little while. That was certainly an honor for me, and I miss that every day. But now I get to work with you different, which is a lot of fun too. So tell us a little bit. You mentioned it. It sounds like you work with students all across the Geisinger health system.
Yeah.
Tell us a little bit about what you do on a daily basis, where that's leading, any vision that you have for that role.
Yeah, it's so I'm about a little more than a year into the role, and I think for every time I think I know exactly what I'm supposed to be doing, another leaf gets turned over and I see another place that I can contribute. And so when I started with the system, with the educational oversight for what's going on in pharmacy, specifically with students, it was kind of two-pronged. The first was making sure that we were maximizing the number of students that we could get into the system. With so many different hospitals and ambulatory clinics and community pharmacies and specialty pharmacies and home infusion pharmacies and different specialties within all of those, it was a opportunity to bring students in to show them the full gamut of things that a pharmacist can do. I mean, just like me, I started with one idea. I want to be able to expose students to all of the other places where a pharmacy degree can take them. The second prong of that then was also working with the pharmacists who were in Geisinger, who were unbelievably strong in everything that they did. And I had to then say, well, what can I do to make them better, right? And that's really hard. I mean, when you've got a golden nugget in front of you, you can only polish it so much. And that's what I had to do with the group of pharmacists. And that's what I'm looking to do, is make sure that they have the resources that they can be as good as they possibly can with everything that they do. And that might be their professional development within the area where they practice. It might be that they want to learn how to interact with younger pharmacists or resident pharmacists or student pharmacists better, so they can really maximize the impact they have on them. And so a lot of what I do is working with the clinical pharmacists and the administrators within the system to say, what can we do to help you be even better at what you do when it comes to educating and training people? And while that's just kind of a small snippet of what I do, that's where students are supported. Another place where I have the opportunity to support students is after they're done. So in what we would call graduate pharmacy education. So you've graduated from pharmacy school, and what can we do to further your career along? And that is through what's called residency training. And the residencies within Geisinger are growing leaps and bounds. And the purpose in pharmacy for a residency is that it gives you a really focused amount of experience in a short period of time. So where you would graduate and you may work in a facility for a year, that counts for about a year's worth of experience for you. When pharmacists do residencies, which aren't required in order for someone to get licensed, but for a pharmacist to do a residency, it bangs about 3 to 5 years into 1 year of experience, which is really helpful as people want to advance their careers early on. And so those are kind of the big ways I see myself interacting with students in my current role. And there's so many other things that go along with this job. I'm always happy to share details of it.
Yeah, no, it sounds great. It sounds like, Dan, that you do quite a bit of what I would consider to be, in the broadest sense, leadership. Leading the profession, leading the professional development, in some cases, leading people directly. During your time at Wilkes, either as a student or as a faculty member, I guess when I hear you talk about your career, it's certainly probably what a lot of students don't necessarily think about when they think about pharmacy. You thought about the traditional community pharmacist at, maybe a
Yeah.
chain pharmacy to start out with. I would bet that a lot of people listening to this think about the same. How did Wilkes, your experience here, prepare you for the role that you have now? Like what is it about being a student, being a faculty member here that you think prepared you for this?
Yeah. The student aspect of it, I think a lot has to do with networking, right? And at the time, you don't realize who's sitting to your left and who's sitting to your right and what they bring to the table, and you develop these really strong friendships, and so you know them as your mates, as your friends. And then as you graduate and you keep those connections, you realize that they're taking a different professional path, but so many things that they do in their professional paths influence what you do, or lead me to think about what I do. And so the school prepared me in one way, in that I was able to make some fantastic connections with people who I'm still connected with today, that when I have a problem or I'm not sure what I'm supposed to be doing, I can reach out to them. Also, when I confront certain problems, I remember fill in that person's name, whoever it might be, talking to me about this on the phone or over email, or, when we would meet for a picnic, and I could kind of refer back to what they did to guide me in what I did. I think the other aspect of it, though, is there were faculty within the school that were tremendously influential. I mean, and there are people that I can point back to the day and time that I interacted with them, that they've told me things that still stick with me, right? I can remember the day that I learned that I matched a residency. I saw one of the faculty members in the hallway, and I said to him at the time, I said, "Hey, I matched to go to," and I went to a program in South Carolina. At the time, it was called Palmetto Health Richland. It's now called Prisma Richland. And he said, "You know what? It's one of the best things you can do." He said, "Go somewhere else, learn something new, and then bring it back home." And it's exactly what I did. And that's always stuck with me. And so it's, I don't think I ever received some big life-changing piece of advice, but when I take those little interactions that I had with the people who were my advisors, the people who were my mentors, I stuck with it. Faculty were also really, really big in my development. And, I think I used to be a little bit embarrassed to share it, and now I will share it. I struggled as a student. I had a really tough time finding my way in my own professional development. And I think a lot of it was, especially early on in my pharmacy school career, I approached it like I had approached my undergraduate, or I had approached my high school, which a lot of people probably may do, is you get by. And I got by well. But then when I got into a professional program, I struggled a bit. But I had one faculty member who, over a summer when I had to repeat some courses, stuck with me. She met with me on a twice-a-week basis. She didn't have to. We reviewed all of my work. We made sure that I was ready for the courses that I needed to repeat. And when I repeated them, I did well. And her investment in me made me better invest in myself. And it sticks with me to this day. And I think it's molded me in that, even for a person who is struggling, it leads me to realize that they can't be discounted, that we need to stick with them to the best of our ability, make sure that there isn't something that we're missing for them, because they can be the next success that just maybe at a point in time in their life where they're struggling, or things just haven't clicked for them.
Yeah. To hear you talk about that, I mean, one of the things that is striking to me on a daily basis here at Wilkes is the importance of relationships. You were here a lot longer than I was, and that there was an intentional decision always for the pharmacy classes here to remain small,
Yeah.
among the smallest. Do you feel like that size, that level of intimacy, both among students and faculty, do you think it facilitates those types of relationships?
I think so, and with me being on faculty for a period of time at Wilkes, and I developed some really strong professional relationships with students that I still see to this day. And if I were faced with 150, 200 students, I don't know if I would have been able to do the relationships I was able to form. I could go through when I would teach a class and look at 72 students, looking back at me, and within a short period of time, I felt confident and I knew that I could go through and I could name each student, both their first name, their last name, and at least know one fact about them. And I think I didn't, and I don't want to say I made an effort to, right? I didn't seek them out to learn that one fact, but I was blessed enough that in my daily interactions with students, because the classes were so intimate, they were tight, they weren't huge, I could just through my passings learn at least one fact about them. And that was really meaningful for me, because it was always a conversation starter. It was something that I could carry through, and I always learned that they learned a little bit more about me than I learned about them, unfortunately. But I think just knowing that one thing in that student's name helped me feel connected to the learner.
Yeah, I feel that connection as well. It's a special part about being here for sure. You work with students now from broadly, more than one, sure. All pharmacy schools are good, produce competent pharmacists who get licensed. Is there any particular strength or skill set that you see among the Wilkes students or the Wilkes graduates that you would say, is particularly strong?
Yeah. I've always felt, and this is feedback from some of the other institutions where I worked at, where I was a clinical provider as I was teaching students, and the pharmacists there would tell me, and I truly believe it. It's the communication and the empathy and the connection that students from Wilkes form with the people that they care for is really strong. The teamwork and the team dynamic that they create in the people that they're working with is really strong. I mean, it's remarkable to see that when I would have students on rotation with me from Wilkes, that when they left at the end of 5 weeks of a rotation, the nurses, the medical assistants, the physicians would ask, where are they? How are they doing? That was really unique, that bond that the student could create with people at the practice site, with the patients that were there, could grow so quickly in such a short period of time. And, you could chalk it up to one person's personality. But I mean, when I was on faculty, I took 12 students into my practice site every year for 14 years, and it was always happening. It was always the theme. And so for me, that's what sets a Wilkes student apart, is that just that personal connection that they're able to form with the people that they work with and the patients that they care for. It's hard to replicate.
Yeah, it's very interesting, because I think we have almost the same perspective on that. I've been at other pharmacy schools in my career as well, and all pharmacy students are very smart and very inquisitive. But the relationships that the Wilkes students make with people, and the way that they care about people, and the way that they're just good people themselves, is really it's really impactful to me. So I guess, one of the questions that, and we'll finish up here in just a little while, but one of the questions people might have that's listening to this is, should I choose pharmacy as a career today? What do you think?
I think everyone's expecting me to say yes, and my answer is yes. I think there's reasons though that it still remains yes. Scott, it's not foreign to you and I to hear that there are people that are not actively promoting students going into pharmacy school. And I think what you have to understand is that there's a spectrum. There's a spectrum of pharmacists within the world that have an experience with the profession. And unfortunately, there's one or two aspects of the profession right now that are on the cusp of evolution, meaning they're on the cusp of change. And I think a lot of times if you talk to people who are on that cusp of change, they're seeing some things that aren't perfect for them right now. But when you look at everything else that's going on in pharmacy, when you look at the evolution of the way a pharmacist interacts as part of the healthcare team, that pharmacists are being involved in what's called value-based care, meaning instead of getting paid for just going out to see a patient and making a decision, it's now using a pharmacist to help make sure that the patient is taken care of. And when you take care of that patient, that's when you say, okay, I've done my job. That's huge. And we're seeing value-based care fall into every aspect of pharmacy right now. We're seeing it on the inpatient or acute care or the hospital-based side, making sure that patients are well cared for, making sure that they receive the medicines and the education that they need so they don't come back to the hospital. We're seeing it in the outpatient or the ambulatory side, where patients are in the physician's clinics, making sure that the patient who has diabetes is on all of the right medicines that they need, that the patient who has high blood pressure is getting the medicines they need. You see it in the community pharmacies, where when patients come in to pick up their medicines, pharmacists are advocating to make sure that they're immunized, making sure that they're having the correct blood work and tests done to know that the medicine is working for them and staying safe. And when you put all that together and you see all that and you take out the idea that there are a certain number of things that somebody has to do every day, it's a wonderful profession. It's a wonderful thing. And I would highly encourage people to get into it. And particularly when you get into it, explore all of the options that you have that you can follow in pharmacy. If you've made a decision of where you're going to go and you don't take the opportunity to look at all the other things that you can do, then it might not be the best choice for you because you feel like you're stuck in one spot. But I'll tell you, 99 out of 100 people who are going to apply to school, and please don't quote me on that number, if you take an opportunity to look at everything that you can do within pharmacy, you're going to have yourself a wonderful, fantastic career that allows you to probably see 3 or 4 different things that you never expected to see when you made the first decision.
Yeah, I completely agree. I think there are wonderful opportunities in pharmacy beyond even what we know today. That will continue
Absolutely
to evolve. It's been a great career for me. I think it's been a wonderful career for you. But I think also as people come into this profession as students, we also need people who are going to continue to serve as change agents.
Oh, yeah.
And continue with that evolution that has begun and push that, continue to make pharmacists an integral, an essential part of that healthcare team. We need people to keep that momentum going forward.
Yeah. And Scott, I think that's the beautiful thing with this too, is it's atypical for me in my day to have an idea about something that can be done, no matter how far fetched it may seem, that someone isn't willing to investigate it. And so you talk about a change agent, and I think it's important to have people who can be an executor of change, so the person who activates it, but then there also needs to be people who think about those ideas and say, what if we did this? And it's those people who end up really changing how things work. So there's so many different layers within that. You need the people who think about what change should look like, and then the people who make the change happen, and then the people who see it through. I think we don't give enough credit to the individuals who may not have the idea, who may not have kind of the operational knowledge to get things done, but on a daily basis, they make sure things get done. And that also facilitates change, because when things get done, it gives those other individuals within a system the opportunity to say, okay, that worked well. Let's figure out how we can take this even further. And that's interwoven everywhere throughout pharmacy.
And one of the gifts of being here at Wilkes is having the opportunity to work side by side with Geisinger, who I think in almost every way embodies what you just said. Geisinger is not an entity that sits still. I mean, if you look at the innovative healthcare systems across the U.S., it's one of the names that you always hear about, pushing change, pushing the envelope, doing things differently. And we're very fortunate, and I'm sure you feel very fortunate to be a part of an organization like that.
Yeah, it's been a remarkable time to be with them, and I say you think you know everything about an organization, and then you get inside of it, and you realize that you maybe only read the back sheet of the book, and you have no clue what's in the hundreds of pages of text inside of it, and that's the case here. And if I ever thought that Geisinger was a leader in pharmacy before I came in, I know it for sure now, and the things that I hear happen, that the people who reach out to us to say, we've been trying to do this and we haven't been able to do it to the extent that you've been able to do it. whether it be specialty pharmacy, whether it be, medication therapy management services. There's some big names that get in touch with us on a pretty regular basis. And it's wonderful to be able to collaborate with them, because for everything we're able to share with them, they can share with us, and to have our name be, at the same table as some of these organizations is truly a testament to the leadership that we have within Geisinger, and how forward thinking they are, and how they really think about population health and value-based care, and how can we really create a team to surround a patient and make sure that they're taken care of.
Yeah, we're very, very fortunate to have the relationship that we have together, and I look forward to that continuing to grow.
Yeah.
Dan, anything last minute, anything that you'd tell somebody who's thinking about the Nesbitt School of Pharmacy at Wilkes, or any sage advice?
I can give you the cliche statement, and I say it, but it's 100% true. If I had to go back and do it again, I wouldn't change a thing. I might change how much I studied at the very beginning, to be a little bit more and to focus my efforts. But even then, through my failures, I've learned a whole heck of a lot, and I don't think I would have learned all of that and become who I am today and where I am today without having people by my side and mentors from the school to help me through that. And so I can only say it's a great place to be. It's a great place to go. And I'd love the opportunity to hear any stories from students who watch this and come into the School of Pharmacy, whether it be immediately upon their entry or 10 years down the road, to know about their journeys and how they got to where they are.
Well, Dan, for the record, I just want to point